To another screencast where this time we'll be discussing the gross anatomy of bone. So by the end of this, you'll be able to identify and describe here the gross anatomical features of bones, as well as comparing and contrasting some of the similarities and differences between long and flat bones and the young and adult bones. Let's go back a second. We're going to use a long bone as sort of the model for all other bones here. And then be able to explain why bone is classified as an organ. Okay, so let's get started. Here is a flat bone, but all bones are comprised of compact and cancellous bones. So I want to call your attention to the fact that when you look at a bone diagram or a model, you want to actually be looking for this compact bone as well as the cancellous bone, and where it's located is going to be a little bit different in each one. But while we have this here, let's just take a quick peek at this cancellous bone and what it looks like. Here it seems like that the white spaces here would be a lumen filled with air, but it is a lumen, but it's not filled with air in living bone tissue. It's filled with bone marrow and blood vessels. And the bone marrow changes from a young bone to an old bone, or an adult bone rather, and we'll talk about that in just a second. But the actual pieces of bone here, these bridges, these struts, these trusses, are known as trabeculae. Right? So the actual bone part are known as the trabeculae in the cancellous bone, or the spongy bone, as it's sometimes called. Right? So be looking for the compact as well as the cancellous bone. So let's compare here a young bone with an adult bone over here. And again, we're looking at a long bone here as a representative, and we're just sort of taking this proximal end here of this bone, and this happens to be the femur. And so this is the proximal. Remember that proximal is closer to the attachment of the body than this would be the distal end here. And this is the farther away attachment to the axial skeleton. So in the young bone, do you see the cancellous bone? Well, here's the cancellous bone all in here, and the trabeculae are not well developed. There's large spaces between them. In fact, there's a very large space here that is not have any cancellous bone growth in it at all, and that in the young bone is full of red marrow. And remember that red marrow is a site of hematopoiesis. Right? But you also will see this compact bone here around the edges, so the compact bone is solid there around the edge. Compare that with the adult bone here, and again, here's the adult bone, cancellous bone. The trabeculae are much more well formed. They are a little bit larger. They form a much more tighter mesh network in there. And you see that central canal there is sort of filled up, right, in this area, where over here in the younger bone it was not. Okay. While we have this slide here, let's go from the outside in. And so around the outside of the bone is this layer right here, and that is known as the periosteum. Right? So the periosteum, literally around, it's like a perimeter. And osteum, anything osteo here, is bone. Right? So literally this is the layer that's around the bone. Just deep to the periosteum, then you're going to find your compact bone. So here's compact bone, just deep to that. And then deep to the compact bone, you will find the cancellous bone. Right? And now, just as much as there is a membranous cover on the outside here, the periosteum, there's a membranous cover on the inside of this cavity that actually lines all of the cancellous bone, lines all those trabeculae, as well as this central medullary cavity here, and that is the endosteum. Right? So the endosteum here, right? Endo, inside or within. Oops. Inside or within the endosteum. Okay, and then that is going to be protective. That is can be considered sort of an epithelial layer there. Right? I mentioned this word, this medullary cavity. So as the adult bone gets more and more filled up with, you notice that the compact bone is thicker here. There's a little bit more cancellous bone here, and as we age, that red marrow is converted into yellow marrow, and that is where fat is going to be stored. So this yellow marrow here is fat and the red marrow is the site of hematopoiesis, right, blood cell production. Before we leave this slide, we just want to talk about how in the end of this long bone here, this irregularly shaped head right here, this is known as the epiphysis. Right? And so that's what we're showing you here. So the epiphysis is this, again, is this area here of the bone, and then the shaft of the bone is the diaphysis. Right? Diaphysis would be the shaft of the bone. And of course, in a short bone, you don't really see the difference between an epiphysis and a diaphysis. In an irregular bone, you don't see that. And in a flat bone, you're not going to see that either. Right? But let's just look at a little more detail here. Last slide of this bone. And so now we're taking a section through the diaphysis here. And when we look at the diaphysis, let's go from outside to in. Right? So the outside layer here is this. Here's the periosteum. And a little bit more detail, of course. There's this cellular layer that, of course, needs blood vessels. So we see blood vessels coming to this. So there's actually cells in this periosteal layer. And then there's this fibrous layer, which is a connective tissue layer, and this is again mostly fibers, and those fibers are going to connect that periosteum very tightly to the underlying compact bone. So this is all compact bone here, right? And then we see some endosteum lining, some endosteum lining right here, and that endosteum is covering all the trabeculae again. So there's a trabecula, there's a trabeculum, right? And so all the trabeculae there of the cancellous bone, and you see that here, the cancellous bone with the trabeculae there. These again, this medullary cavity, if this was a young bone, then this would be red marrow, and since it's an adult bone, yellow marrow is going to be in there. In another screencast, we'll be looking more closely at this microscopic anatomy of the bone right here, and we'll be looking at these osteons or haversian systems, and again, this is going to be covered in the microanatomy, and we'll be looking at the cells and things that you have there. So, opportunity to review. There's a picture of a model that isn't exactly like the one we have in the room, but you should be able to grab this model and look at that and look at some of the gross anatomical features of the bone, as well as the skeletons. Go get a skeleton, identify your long bones, your short bones, flat bones, irregular bones. Look for the diaphysis, look for the epiphysis, right? So practice identifying those things, saying those words. And thanks for listening. Oh, here we'll just summarize here what you should be able to do. There's gross anatomical features of the bones, and again, we sort of focused on the long bone there. But being able to compare and contrast a long and a flat bone, what is similar, what's different between them, and then a young bone and an adult bone. Right? And we didn't really talk about this, but you should be able to figure out here why this bone is going to be classified as an organ. Okay. Again, thanks for listening. Bring your questions to class.